Chapter 10 Herbal Remedies that helps in traumatic brain injury. Herbs have a significant role to play in the long-term recovery from a traumatic brain injury. It is best to cure gradually and steadily using nourishing, energizing, and restoring herbs. When first utilizing circulatory stimulant herbs, it is advisable to proceed with caution. Ginkgo biloba and even peppermint or ginger are examples of herbs that might improve blood flow to the brain. When the time is correct, this can benefit neuronal tissue greatly by supplying it with oxygen and nutrients. Excessive stimulation may not be necessary in the first few weeks or even months, depending on the circumstance. Herbs and supplements support the healing process and may also lessen symptoms over time and speed healing. The more we take care of ourselves, the more complete healing, and the less likelihood of unforeseen long-term consequences. 1. Bacopa monnieri, commonly known as water hyssop or brahmi, has been used for centuries in Ayurvedic medicine, alone or in combination with other herbs, as a memory and learning enhancer, sedative, and anti-epileptic. Bacopa can be found growing wild in India, the United States, Australia, and East Asia. Bacopa has been used for thousands of years as a brain tonic to prevent memory loss, relieve anxiety, improve concentration, and to treat inflammatory conditions like arthritis, bronchitis, and edema or swelling. Traditional indications include anxiety, anger, insomnia, nerve pain, nervous stability, anxiety, depression, hypothyroid, Hashimoto's thyroiditis, epilepsy, Alzheimer's, panic attacks, headaches, tremors, mental illness, stroke recovery, recovery from head trauma, muscle spasms, paralysis, anemia, and weak immune system. Bacopa is said to steady the mind and increase concentration and is used by meditators to reach higher states of consciousness. Suggested dose is a cup of tea, 2 to 3 milliliters of tincture or liquid extract or 300 milligrams of standardized extract, all 2 to 3 times per day. 2. Wild oats, Avena sativa. One of the most beneficial plants for soothing and nourishing all levels of the nervous system, Avena or wild oats, has a special affinity to the central nervous system, helping to cool, soothe and restore it to normal function regardless of the stressor. This is a safe and nutrient-rich herb that heals through rejuvenation and vitalization. Avena acts as a general restorative and antidepressant that helps reduce inflammation and anxiety while soothing, protecting and improving healthy nerve function. 3. Ginger can help relieve nausea and reduce inflammation after a TBI. It has phytochemicals with excellent anti-inflammatory properties, which relieve pain in joints and muscles. It promotes the circulation of blood and acts as a cure for nausea, headache, and cramps. Ginger is an anti-inflammatory and antioxidant that increases circulation, improves blood viscosity, and reduces the risk of blood clots. The easiest way to incorporate ginger in your diet is to have ginger tea. You can also grate the root, wrap cheesecloth around it, soak it in hot water for 30 seconds, and place it on your back for 20 minutes. It also reduces muscle pain and soreness. A topical application of the paste of ginger, cinnamon, sesame oil, and mastic can reduce pain and stiffness in muscles. Ginger also dramatically lowers blood sugar levels. 4. Ginkgo biloba. Ginkgo leaves are a cerebrovascular trophorestorative, with antioxidant and vasodilating properties. It contains a type of flavonoids called glycosylated flavonoids that improve circulation to the brain while it directly reduces edema or brain swelling. Ginkgo also has a special stabilizing effect on the smaller blood vessels, helping them to pass nutrients and oxygen more efficiently. The herb works very well. However, it is a strong circulatory stimulant and may be too much for some people depending on their level of injury. 5. Ashwagandha. The powder or extract of ashwagandha, Withania somnifera, when coupled with relaxation techniques, is quite restorative and effective for insomnia. Ashwagandha also helps with central nervous system cognitive symptoms, making it a good choice following TBI. 6. Turmeric has a chemical called curcumin, which helps fight pain because of its antioxidant and anti-inflammatory properties. Turmeric is a general, body anti-inflammatory helpful for treating central nervous system injury and inflammation. It also helps improve motor function and the ability to learn. According to some studies, the incorporation of curcumin increases by 2,000% when you consume it with black pepper. Turmeric supplements contain not only higher percentages of curcumin but also black pepper to enhance their effectiveness. 7. Blessed thistle, Carduus benedictus. Blessed thistle works wonderfully for some common symptoms like ringing of ears, blurry eyes, dizziness, or a feeling of instability. 1 to 3 milliliters a few times per day acts as a nerve tonic specific for poor memory, tinnitus, poor hearing, and dizziness. 8. American ginseng, Panax quinquefolius. American ginseng is a whole-body tonic that normalizes body functions, helping the body, mind, and spirit deal with stress of all kinds. For our purpose, this herb helps to improve concentration, memory, and insomnia. It helps relieve weakness, fatigue, and depression and shows promise as a brain rejuvenation agent, enhancing the ability to learn and retain information while preventing memory loss. 9. Valerian root. Episodes of depression, mania, anxiety, memory loss, cognitive dysfunction, and insomnia can be associated with the recovery from TBI. Insomnia can benefit from valerian root extract. This herb is a natural muscle relaxer that also reduces nerve sensitivity. Since it can make you drowsy, it is advised that you take it at night and only as directed to avoid overdose. 10. Lobelia inflata acts quickly to affect spasming, causing the body to relax, and calming excited muscles. Lobelia also has a soothing effect on the mind and emotions, helps to calm down. Drop doses are most appropriate for internal use. Alternately, it can be applied externally to the area of discomfort. 11. Mullein tincture or tea. The entire mullein plant is beneficial for healing. The stalk, but also the leaves or flowers, have a long history of positive action on the spine. The plant is known to soothe and help heal synovial fluid around the joints. It also has anti-inflammatory, demulcent, sedative, and astringent properties. 12. Oregano is the herb found locally and widely used in the culinary arts. Besides from its taste, this herb also serves in various ailments due to its anti-inflammatory and antioxidant properties. Oregano leaves are high in phenols, which are natural phytochemical compounds with beneficial antioxidant effects. The two most abundant phenols in it are thymol and carvacrol. Among these, carvacrol has antimicrobial, anti-tumor, antimutagenic, analgesic, anti-inflammatory, and antiparasitic properties, making it one of the most active components of oregano when infused in carrier oil. 13. Sesame. Sesame seeds are used for traditional remedy against various ailments for centuries. It has high antibacterial and antioxidant properties. Sesamol, sesamolin and sesamin are the antioxidant components present in its seeds. Among these, sesamin is a lignin with anti-inflammatory properties which helps in pain relief, reduce spasm, and increase range of motion when applied to the affected area. Many studies have proved its therapeutic and healing properties that sesame seeds, when infused in oil, applied to the painful area, stimulate the blood flow due to its excellent emollient properties. 14. Garden cress seeds, also known as Lepidium sativum, is an edible fast-growing herb which has been used in ancient medicines for a long time. Its seeds contain significant amount of plant sterols, which are antioxidant and anti-inflammatory compounds. It also contains phenolic compounds which fights at molecular level and inhibits the substance involved in inflammation. The seed, when infused in the carrier oil and applied to joints or muscle pain, helps recover from muscle weakness, reduce muscle tension, and promotes pain relief. 15. Cramp bark. Cramp bark is also known as cranberry bush. It comes in the form of liquid extracts, tinctures and capsules. Native Americans consume cramp bark since ancient time. Most people find it challenging to identify cramp bark and black haw, which is also sometimes referred to by the same name. As the name suggests, it is used to relieve pain from all sorts of cramps. For acute pain, 30 drops of the tincture can be taken every hour until the pain subsides. Cramp bark contains chemicals that significantly reduce muscle spasms. They also decrease heart rate and lower blood pressure. The bioactive compounds are extracted from dried bark and made into tinctures. 16. Gotu kola. A native of Asia and the Indian subcontinent, gotu kola has been used for thousands of years in Ayurvedic medicine. Gotu kola is an herb known to boost brain function and is an anti-inflammatory used to treat arthritis pain. As a brain tonic and neuroprotective, gotu kola improves cerebral circulation, stimulates the growth of healthy brain cells, and boosts plasticity and communication between neurons. Gotu kola's analgesic action may relieve some of the other bodily aches and pains related to the injury. Suggested dose: 4 ounces of tea, 30 to 60 drops of tincture, or 50 to 250 milligrams of standardized extract, all 3 times per day. 17. Rhodiola rosea is a versatile adaptogen that optimizes serotonin and dopamine levels and helps protect brain neurons. It is useful for mild to moderate anxiety and/or depression to increase mental alertness, improve memory, and reduce fatigue and brain fog. Rhodiola is best taken early in the day. If taken before bed, it can cause stimulation and sleeplessness. 18. Rosemary. Rosemary protects the brain from the effects of neurodegeneration, which can cause or exacerbate Alzheimer's disease and other age-linked conditions. It contains carnosic acid, an antioxidant that guards against chemical-free radicals that lead to degenerative disease. This savory herb can also protect against stroke and decrease macular degeneration and other vision problems. Rosemary has these benefits, whether consumed fresh, dried, or as an oil. Herbal tea.